All right, so do you happen to be dealing with joint pain or stiffness? If so, it hasn't worsened. What? Has it worsened in time? Has it? This is what happens when you get towards the tail end. Has it worsened with time? I just want to know. You got to tell me. You could be suffering from arthritis, which is not a good thing.
And joining us now is Dr. Frykberg. He is part of the JOI team. Welcome back to the show. It's so good to see you. We appreciate you being here as always.
It's good to meet you for the first time.
Let's talk a little bit about it. I'm sure people know what arthritis is. We can get into that more in-depthly in a second. But first, let's talk about how it's treated. How do you guys at JOI treat arthritis to relieve people's pain?
Well, there's a lot of ways to treat arthritis, and I tell this to most of my patients who come see me, but we always start with the less invasive first. Arthritis is really an inflammatory process or inflammation in the joint. The easiest way to treat it is simple weight loss. You know, every time we take a step on a stair, 6 times our body weight goes through our knees, 6 times. So a simple weight loss of 5 pounds, 10 pounds can be 30, 60 pounds off of our knees every time we take a step.
So it's that critical, losing weight.
Yes, it's the one way that we really understand how to treat arthritis with no medications and surgeries. It's just simple weight loss.
So let's say we've done the weight loss, but we're still experiencing pain. What would be the next step along the process?
The next step, and it could be included with the first one, is anti-inflammatory medications. Aleve, ibuprofen, over-the-counter things, once-a-day pills. There's hundreds of different kinds. But it's treating the inflammation caused by arthritis with an anti-inflammatory medication.
So at what point, you've done all these things that you're talking about, at what point do you realize, you know what, I should probably get surgery done?
Well, before that, you should be walking through this with, say, an orthopedic surgeon or primary care physician that kind of leads you down the path, and try activity modification like canes, not playing soccer every Saturday when you don't do anything the rest of the week. Doing non-impact exercises, cycling, swimming. We live in Florida, so access to a pool is usually pretty easy, but there are fantastic ways to keep the joints moving and without...
Workout without heavy, hard impacts on our
Exactly. And so once that's failed, surgery may be in the cards for you. And when the right time is, it's hard to know. As an orthopedic surgeon who specializes in joint replacements, I have a great job because I don't perform life-saving surgeries, but we perform surgeries to give back patients their life, give them back their lifestyle.
Right, they've been dealing with this pain sometimes for years upon years, and they're just looking for a little bit of relief. What are you doing in the surgery that could not have been accomplished through other means? Are you going in and removing things? Are you adding things? What are you physically doing in that surgery?
Well, arthritis surgery is, when it gets to the point of failing everything out, failing every other aspect of treatment, is not minimally invasive by any means. It's more of a maximally invasive surgery on the inside. It's just cutting out the arthritis. It's cutting out all the cartilage, all those pain receptors associated with it, straightening out the knees or hips that have been bent or turned with the evolution and progression of arthritis. And once that occurs, it makes the patient walk better, walk with better alignment, the muscles start to work better, the arthritis pain is gone.
And talk about this, because this is really cool, is with technology and over time, you've come up with robotic surgery, which makes it very specific and very, I mean, you get those minute details, so the surgeries are much more, it's much better in the end, isn't it?
Correct. And JOI has been offering the robotic partial knee replacements for quite some time now, and recently have just upgraded to the hip replacement being a robotic surgery.
Wow. And
most people come in and say, oh, well, I don't want the robot doing the surgery, I want you doing the surgery. And that's a misconception because we do this, correct, we do it with the robot at hand. And the robot really adds, like you said, preciseness, accuracy in placing different objects in space. And it really helps with all the possible complications that could occur with surgery. They're virtually eliminated from a bone standpoint and from a surgery standpoint with robotic surgery.
Let's talk about when is the right time to see an orthopedic surgeon about hip or knee pain. I mean, obviously, if you've been dealing with it for a long time and you've been taking, acetaminophen or ibuprofen to try to make a difference and it's not really working, I would suppose that would be a good time to come in.
That is, but most people will wait and wait and wait to see an orthopedic surgeon. I say it's better to see one sooner rather than later. Have the orthopedic surgeon as a guide to walk you through the process. Nobody really comes in saying, I want surgery, until the very, very end. but to have somebody, to have the relationship, doctor-patient relationship with, and really walk through the process, the patient feels comfortable in the end, they're going to know when they need surgery.
And you can get out in front of it. You know, if you can try to do some things, like you said, losing the weight and maybe prevent or prolong the surgery, that would be a good thing.
Exactly.
Good stuff. Well, thank you for all that you guys are doing over there.
I appreciate it.
JOI. If you, we'd like to thank Jacksonville Orthopedic Institute for sponsoring this segment. To learn more, just go to joi.net.